The University of California, San Francisco is now launching a contact tracing training program to help track the spread of the virus. The process could be crucial, as you know, in containing the illness. With us tonight is the principal investigator of that program, Dr. George Rutherford. Dr. Rutherford, I appreciate you being here. Can you give us an idea of how all of this is going to work?
Sure. Thanks, Scott. So the University of California, San Francisco and the San Francisco Department of Public Health have a long and very cordial and very close relationship. Early on in the epidemic, the director of public health asked UCSF if we could possibly help with contact tracing. So we sent over 2 or 3 people who basically got the lay of the land, put together a curriculum, and then trained 40 of our own people from UCSF to start contact tracing the next week. The week after that, we got people from who were working for the city and county of San Francisco who had been unable to work, to add to that group another 60, and then another 40 to 60 the week after that. So currently the workforce is made up by some people from UCSF, a lot of people from the city and county of San Francisco who have been repurposed for this, people from the city attorney's office, the assessors, city librarians, and then some of our medical and nursing students who are doing it for credit, and some retired clinicians from the San Francisco Department of Public Health.
How difficult?
And basically, it's a
sorry for interrupting you, but how difficult is the process itself, just to do the contact tracing, to get people to be able to find the right people, and to get the people they find to be able to give them the truth?
Well, it's not without its complications. So it starts with the person who's been reported as having the disease. There has to be an intake interview to understand with whom they've been in close contact over the last 5 days. We then go and try and contact those people if they've truly been in close contact, to bring them in for testing, and then to arrange for isolation or quarantine, depending on if they're positive or negative, and then have the wraparound services so people can remain safely in isolation or quarantine, and their families can be taken care of, for instance, in some cases.
It's a very big task. How many people do you think you'll ultimately need in what is a very big state?
So in California, the first order is to train 10,000 people for the state. And that's on top of a workforce of a few thousand who are already in these kinds of roles. So it's by the end of the month. So it's pretty much of a Herculean task, but we're up to it. And we have partners at UCLA who are terrific, and we're pushing it forward.
We will all be rooting for you. That is for certain. Dr. Rutherford, I appreciate your time this evening. Thank you for being with us.
Thanks very much, Scott.
All right, let's bring back in Dr. Gottlieb as we finish our conversation. How is this going to go, Dr. Gottlieb? Are we going to be able to pull off a Herculean task, as that doctor told us?
Well, look, this is exactly what states should be doing, and unfortunately not every state's doing this. I think that the criticism of contact tracing in this context is that there's just going to be so many cases, we're not going to be able to keep up with all of them. And that's true. We're not going to be able to keep up with all of them. But if we can keep up with a percentage of them, even a small percentage, even 15, 20% of the cases that we can actually trace and do the contact tracing that the doctor described, or maybe even less than that, that can dramatically reduce the propensity of this to become epidemic again. So we have to try. We have to try to reduce as much spread as we can. And so this is a very good tool for doing that. And this is something that South Korea did with a lot of success. South Korea never locked down their economy. They never shut down like us, even though they had an expanding epidemic, because they were able to keep up with the cases. Heading into the fall with good testing in place, with some therapeutics that potentially will work, if we can couple that with aggressive contact tracing and try to reduce the number of cases that go on to have secondary and tertiary transmission, we could potentially keep this from becoming epidemic again heading into the winter. That's what we have to try to do.
But you just said that what California is doing is not being copied in other states. Why is that? Why are they late to the game?
Not right now. I mean, there's states that are investing in this. Massachusetts, I've been working with them. They're making a big investment. Maryland is. New York is. I think that there's some states where there's a lot of political controversy around this, where people feel that the idea of the government doing this kind of contact tracing and tracking people down and asking them to self-isolate is sort of big government and is intrusive, and there's been some pushback. And so this is a political debate that we really need to have in earnest in this country, because I think every state needs to be doing this at some level if we're going to prevent this from becoming epidemic again. We also need to make sure that being positive for coronavirus isn't punitive. So if you are positive and the government does ask you to self-isolate, people should be given some compensation, perhaps, be allowed to self-isolate if they want in a hotel rather than at home, so they can do it safely away from their family. If they want, they should be given that option. We need to make sure employers continue to pay people so you don't lose wages because you're agreeing to self-isolate so that you don't infect other people. We need to find ways to make this non-punitive. If it's a punitive process, if being positive suddenly invokes all of these restrictions and you're forcibly quarantined, people aren't going to go out and get tested. So we need to think very carefully about that. I know California is thinking about that, and so are the other states that are doing this.